Hold on, shoot. I am the host and the whatever else I was before. Like us, you know what? When Alex is gone, so I'm doing both. So forgive me for juggling all of this. Just welcome everybody. Great to have you. I just wanted, before I hand it over to Lynn and Mark on tonight's topic, I just wanted to remind everyone, we had sent an email out for everyone to give feedback about the workshops in September and October. And I see Christy's on here. Christy, I just got your email. Thank you so much. We would love to get other feedback. I think we've heard from maybe 4 or 5 of you. So please give us your thoughts. So we, get these as, representative of what everybody wants. That would be great. Tonight is on immune disorders and immune health, I should say, and autoimmune disorders, which is crazy how many people are impacted by it. So I'm going to hand it over to Lynn and Mark. Lynn, do you want to come on? And then I think I can't mute because of the webinar thing, but let me share my screen, just stop my video. Okay, cool.
Got it. Great. Thank you, Jenny. Well, it's nice to see some of you on here live, and to those of you tuning in afterwards, thanks for listening in. I heard you were in really good hands last week with Mac's amazing mindfulness workshop. I watched it afterwards and it was great. But tonight we're digging back into the meaty topic of the immune system. And as Jenny said, autoimmune issues as well. So let's dive in. So I'm going to start, and then Mark's going to dive in, and then I'm going to come back, and then so we're going to tag team you tonight. So just to reorient everybody to where we are talking about one of the 8 root cause areas that some of you might have had show up on your PHP. So again, we're talking about the immune system and possible immune system dysfunction and how it could be contributing to some of your symptoms. Slide, please. Okay. So I like to always start by saying, what does Lyra do? What do we do? What is our secret sauce to figuring out why you might have shown up as this area on your PHP? So we start off by asking you some questions, and these are kind of obvious, but questions on the assessment to get a feel for, are you having chronic infections or not? So chronic yeast or fungal infections, frequent antibiotic usage. So that would tell us that you're having frequent infections, but it also can contribute to the degradation of your gut health, which we're going to talk about how important that is for your immune system. Are you getting colds more than twice a year? We may think that's normal. In our world, getting colds, just a common cold more than twice a year, could be a sign of your immune system not being robust. Frequent cold sores, cold sores are come out when your immune system is weak. So that's a sign that you could have a weakened immune system. Frequent UTIs, again, shouldn't be getting UTIs. If you get a UTI, you're going to have to take an antibiotic, which is further going to weaken your immune system. And then prolonged stress. We're going to talk about how that impacts your immune system. So those are all the clues that we got from the assessment questions. And then the next slide talks about how we measure it. And there's basically 2 things that we're doing. On the baseline labs that we did for everyone, we checked those thyroid antibodies, the thyroid peroxidase antibody and the antithyroid globulin antibody. And I'm going to dive into more of that in a moment, because that's what's associated with that Hashimoto's condition. And then for some of you, we also did some additional testing, and that's the Immune Health Advanced Diagnostic and the Celiac Advanced Diagnostic if you had high gluten sensitivity pop up on your baseline labs. So those are the main ways where we're doing testing to further dive into this topic. All right, so Hashimoto's. As I said, the way you diagnose Hashimoto's is with an elevation of one of those 2 antibodies, thyroid peroxidase antibody or antithyroid globulin antibody. And basically, this means that your immune system is attacking your own thyroid. It creates inflammation in your thyroid and eventually could cause your thyroid to stop working as well. Now, this is actually a really common condition. It's the most common reason why people get diagnosed with hypothyroidism. It's just that your doctor's not checking these antibodies. So for instance, if you're found to have high TSH, which is the main marker of what a conventional doctor would use to check whether you have hypothyroidism or not. That's basically all they do. They check TSH. Sometimes they check T4. We talked about this during our hormone webinar where Dr. Severi was comparing T4 and T3, those two thyroid hormones that are produced. Sometimes doctors check that, but they almost never, ever, ever check thyroid antibodies. Why? I hate to say they don't care. That doesn't sound good, but they don't do anything different. If they find that you have high thyroid antibodies, have Hashimoto's, in their world, it doesn't mean anything different about how they're going to treat you. They're going to wait and see if eventually the attack becomes bad enough that your thyroid stops functioning as well. And then they're going to put you on thyroid medicine. And that's really all they got for you. So from their point of view, there's really no sense checking the antibodies because they're not going to do anything different. In our world of being preventative minded and proactive, there's a lot you can do if you find these Hashimoto's antibodies early on in the process. That's why we check them. But again, it's really, really common. A lot of people walk around with elevated Hashimoto's antibodies. About 5 in 100 people in the United States, or 14 million people, have this issue. So if this is you, you're not alone. I was actually diagnosed with Hashimoto's after the birth of my second child, which is a very common time when women are diagnosed. Anytime your hormones are changing, so that could be post-pregnancy or going through menopause, that's a very common time for Hashimoto's antibodies to appear. It does happen in more women than men. Autoimmunity in general happens in more women than men because of the hormonal influence. But it's a very common thing. Slide, please. So I don't know if you can see this very well, but I'm going to kind of read you what's going on in these 5 stages of Hashimoto's. And stage number 1 is when a person has a predisposition, meaning they may have any autoimmune condition running in their family, or maybe other family members with Hashimoto's, and they're genetically predisposed, but they have no elevation in their Hashimoto's antibodies. Their thyroid function is fine. Stage 2 is where we caught most of you, because there are several of you out there who we did find elevated Hashimoto's antibodies. Most of you didn't know. Some of you did, but the vast majority of people had no idea you had this elevation, but your thyroid function is fine. That's where I was when I was discovered. And it means you have Hashimoto's. It means that you've got this potential for this attack to continue and to worsen and to move to stage 3, which is where you're starting to see the thyroid numbers move a bit. And you progress all the way on through 4 and 5, where eventually your thyroid becomes more and more degraded and destroyed. And if that goes unchecked, you would eventually end up on thyroid medication. But the vast majority of you, I think almost all of you out there, except for maybe 1 or 2, we've got you in stage 2, where we've got the thyroid antibodies elevated, but your thyroid's completely fine. And it may be fine forever. There's no reason why it ever has to go to 3, 4, or 5. If you know you have it and you can be proactive and do something about it. And that's what we're going to talk about. That's what Dr. Severi is going to talk about in a few minutes. Slide, please. So some common symptoms associated with Hashimoto's: being tired with no explanation, and not just normal tired, but like really tired, like I can't get off the couch tired, that type of fatigue. Increased sensitivity to cold, especially your hands, cold hands and feet. That's a pretty common one. Constipation, dry skin, having a puffy round face, brittle nails, hair loss, and not just from a spot, but like an overall thinning, weight gain or trouble losing weight, an enlarged tongue, body aches and pains. Like, you wouldn't associate a thyroid problem with body aches and pains, but people get joint pain and also muscle pain. Disruption or of your menstrual cycle for women that are still menstruating. It become heavier, prolonged. Mood issues like depression, and also just cognitive functioning issues like trouble with memory. And the really interesting thing about Hashimoto's is that you can have any or all of these symptoms even when your thyroid numbers look fine. So you could have a completely normal TSH, completely normal T4 and T3, but have elevated Hashimoto's antibodies and feel like crap and have absolutely no idea. And you go to your doctor, they check your thyroid, they tell you it's fine, you're confused, and there you go about your business. Months, years go by, and they don't discover it until your thyroid is actually destroyed. That's the problem, right? That's the reason why, if you find this now, first of all, you feel like, thank God somebody discovered what's wrong with me, because I felt like crap and nobody could tell me why. But then you can be proactive about it. Then you can never progress beyond stage 2. That's the whole point of why we check these things on everybody, baseline testing from the get-go. Next slide, please. Okay, so Dr. Sideri is going to jump on here and talk about our immune advanced diagnostic tests, which is going to let him, are you out there? There we are.
I'm here.
Go for it.
All right. So just like Lynn was saying, is that so we do the initial questions, we do some testing on you guys, and we find out that there's an immune problem and we want to dig deeper. So what Lyra does to dig deeper is a very specific, well thought out chosen testing to kind of dig deeper into finding out what's wrong with your immune system. So we're going to go over or the root cause of an autoimmune condition or what's going on with your immune system. So let's go over some of these tests. So the first one is called the CD57. Slightly a controversial test. It's slightly a confusing test, but the way I explain it is that the CD57 is it's a certain population of your white blood cells. Like your white blood cells have all these different kinds of white blood cells. When you do the regular blood test, it's just one marker, but we're looking deeper into the white blood cells. And what we have found over time is that one specific subset of the white blood cells called the CD57, when it's lower than normal, it's indicative that if the immune system is just tired. Some people say that's from a chronic infection that just wore it down. Some people think that it is a chronic infection that is present. And some people think that it just means that you're almost genetically or your body is stressed out and the immune system is stressed. Now, why is this important? Because it actually proves that you have an immune deficiency or immune problem. This doesn't mean girl or boy in the bubble immune problem, but there's actually supplements that are made to erase this. There's actually studies done on some specific supplements that try to and can raise your CD57. So it's a way of just diving down and finding out exactly kind of what you need and how to help. The second test that we offer, or Lyra offers, also a bit controversial, is called the EBV early antigen. So basically that's a bunch of great letters and words that mean reactivated mono. So about 92% of adults have been exposed to mono. Some people know it as the kissing disease or Epstein-Barr virus. And what happens is that when you're younger and you share a cup with someone, you kiss someone, you get this virus. Most people have a strong enough immune system to hold this virus back. It's just like chickenpox. We get chickenpox when we're younger. And then if your immune system's stressed, the chickenpox can come out of hiding and turn into shingles. Well, the same thing can happen at a very minor level with this Epstein-Barr. This is not the blood test that you do or the testing you do when you go to urgent care to check for mono. This is something that has to be done with a specific blood test. And basically, when the level is elevated, it means that the Epstein-Barr has come out of hiding, so to speak, and it's kind of wreaking havoc on your body. most people have no idea they have this, but they just have been tired for a really long time. Why this is so important is not only can we treat it by improving your immune system and trying to have that immune system fight better against this infection. This infection has been linked to many autoimmune diseases. There's some really good studies that show that chronic reactivated Epstein-Barr can lead to even things like multiple sclerosis. This became very popular about 2 years ago, 2.5 years ago, is because there's about 7 studies that show that reactivated Epstein-Barr is one of the root causes of long COVID. So this is definitely something that is eye-opening for a lot of people. It's not a serious problem, and if you have it, you're not contagious to everyone in your household, but it's definitely something that can wear your immune system down, wear your body down, wear your adrenal glands down, as well as being linked as one of the root causes of autoimmunity. Next slide. So another test that Lyra offers or does in this advanced diagnostic panel is called the ASO antibody or the strep titer. And this is a little bit similar to the Epstein-Barr that we just talked about, in that I really do mean strep, like strep throat, but it's not, once again, like, oh my God, we do this test and it means you have strep throat. You don't need to do an advanced diagnostic testing to say your throat is sore. But what happens is that people can get colonized with strep in their throat. And then the last point on that slide is it can also be colonized in your gut, which can be found on the advanced diagnostic stool testing, that we do. But what happens is that when the strep is in your throat, in your tonsils, and kind of percolating, so to speak, or it's overgrown in your gut, the immune system wants to fight it and the immune system wants to kill it. But if it's there and it's hidden and it's hard to kind of get to because the immune system has a hard time getting to these places, the immune system will start kind of going a little crazy and it will start like kind of hyper producing. And that's kind of what autoimmune disease is. Some people might have heard about this. There's a little quote here, or a little thing here that says elevated strep antibodies have been linked to anxiety and OCD, especially in children. There's actually a medical condition called PANDAS, PANDAS, like the bear or that animal. But it's an acronym. And basically it's when a kid will get strep throat and their immune system goes so crazy and starts to hyperreact that it causes mental problems like Tourette syndrome, OCD, and anxiety. And we find these numbers in adults. And once again, we look at it like one of the root causes of why your immune system is a little stressed and out of control. And there are different supplements and treatments to try to balance the immune system and help it fight against the strep. Next slide. And then this is more just Lyra trying to be good medical practitioners and Lyra trying to provide good medical care, meaning that if we do the gluten sensitivity testing and it's a really high number, we want to make sure that we're not missing something more serious. And, the only way to really truly diagnose celiac disease is to have an endoscopy where they put the camera down your throat and they do a biopsy. Well, there's a blood test you can do that at least gives you probably 80% certainty that you have some level of celiac. Now, why is that important? Well, obviously, if you have celiac, we really want you to stay off gluten. And it's a serious medical problem because it's an autoimmune disorder, which we'll talk more about. And also that gluten really does damage that small intestine. And it causes that leaky gut that you keep hearing us saying. But also when you have celiac, you really do have to watch out for more things like cross-contamination, the fact that certain different little foods have that in there, and you really do need to do your research about certain toothpaste and medications and supplements. So it's also something that we offer when we want to just make sure we're not missing something. I think, Lynn, you're going to take over from here for a bit.
I'm back. Okay, we're going to start to talk about treatment now. What do we do with all this information that we gather? And I get the joy of talking about my favorite topic, which is start with the basics. We always start with food, right? Because food is medicine. So I just listed a few things here for you that are, I could spend hours talking about the research that shows the support for the different components of these foods and how it supports your immune system. But just having a list like this handy, it doesn't take, you could print it out or you can just memorize it, that these are foods that help your immune system. I'm sure you've heard of some of them, ginger and garlic, but even something like dark chocolate. There are flavonoids and antioxidants in dark chocolate that support your immune system. It doesn't mean eating an entire dark chocolate bar, but the food is the best medicine that you have for keeping your immune system strong. There is something to having a bowl of hot chicken soup when you're sick. It really does help. And there's also things that hurt your immune system, and sugar is probably the worst. Sugar is the most inflammatory, damaging thing you can ingest in terms of your immune system health. So it doesn't mean never, but certainly if you have, an over-reliance or a habit with sugar that you're ingesting it every day, you're kind of counteracting the good stuff you're doing by ingesting that sugar on a frequent basis. And then also sleep. This we're kind of backtracking to what we talked about in week 1 with the foundations, but particularly in regards to the immune system, when you sleep, you produce T cells. T cells are the part of your immune system that helps fight infections. So the more sleep you get, the better T cell production that you're going to get. And also during sleep, you produce something called cytokines. Now, normally cytokines are associated with inflammation. But during the night, when we're sleeping overnight, your body is doing its most repair overnight when you're sleeping, and it does produce more cytokines in order to help keep your immune system strong and on guard. So again, if you're not getting adequate sleep, you're missing out on your body's most reparative and restorative time. And study after study shows that 7 hours seems to be that cutoff where you're going to get the most benefit. So if it's less than 7 hours, which is that question we asked on the assessment, that's one of the reasons we asked, we know that that's going to put your immune system in a weaker state. And then movement. Exercise helps the immune system for many reasons, mostly having to do with how it increases your blood flow and your lymphatic flow. The more your blood circulates, the better off you're going to be at getting the immune cells circulating. And also consistent exercise just helps keep your immune system at a healthy on-guard state, not an inappropriate on-guard state, but just in a healthy state of kind of patrolling the body and looking for invaders. And finally, next slide, please. Of course, my all-time favorite is stress and stress modulation. So remember how innately smart your body is. It's always trying to help you out, believe it or not. And in short spurts, cortisol, that stress hormone we talked about, can actually help your immune system. So if you think about what your body's trying to do, if there's a tiger chasing it, you're in an acute stressful situation, it's like, I know, I will temporarily decrease inflammation because clearly she's got something going on she needs to deal with, so I will help you out, which is awesome. However, prolonged stress is the opposite. If we stay stressed out, if that tiger's always chasing us, it actually increases your inflammation. So again, that's why we asked that question on the assessment, are you under prolonged stress? Because we know that that's going to put your immune system at a weakened state. And we also talked about there's things that you can do to help, which are meditation and mindfulness that lowers your cortisol levels and decreases chronic inflammation. Also things like yoga does the same thing. The bottom line is, in the more calm and relaxed your nervous system is, you're going to have lower inflammation and you're going to be able to fight infections better. Next slide, please. And then again, we talked a little bit about this during our gut health workshop. About 70 to 80% of your immune cells are present in your gut. So a healthy gut equals a healthy immune system. So there's a constant interaction between your immune cells and your gut microbiome. It's sending messages back and forth. Remember, we talked about the enteric nervous system and how that's the nervous system that controls your gut. Well, there's this constant communication, and your microbiome is sending a lot of signals to your immune cells and your nervous system every day. And really the key is balance. It's about the balance between the good and the bad guys, and the diversity. The more balanced and diverse your microbiome is, the healthier immune response you're going to have. And diet, of course, plays a huge role in this. It's particularly interesting when you think about people that have really restrictive diets or eat the same thing over and over again. And granted, I fall into this trap sometimes too, because we have habits and we have things that we like, and there's many reasons why we might fall into that trap of just eating the same thing over and over again. But that's not actually great for our microbiome. Our microbiome really does like variety. There's something to the notion of variety is the spice of life, particularly when it comes to our microbiome. We really should be having a wide variety of foods at all times and not be so limited, because if you're limited, you're only feeding one part of your microbiome. And that lack of diversity really can negatively influence your immune system. And of course, we talked about how do you know this? We do have that stool testing available, the advanced gut health diagnostic that we talked about, because we're going to understand one of the markers we check for is your diversity and your balance of your microbiome. So these are questions that do have answers through sophisticated stool testing that we now have. Next slide, please. Okay. Disclaimer time. Here's where we're going to talk about some specific solutions. Again, this is not a substitute for specific advice for you. And supplements need to be, don't take a supplement without either having a conversation with your doctor or with one of us during your consultations. And I'm going to let Dr. Severi jump back on now. Take it away.
I thought you were doing this one.
No, you're back.
All right, I'll do it.
You're
I
on.
will do it. Okay. So, all right. So let's jump in with this one slide, and then we'll transition to autoimmunity. So, what this first half of this was talking about is going through the immune system, what could go right and wrong with the immune system. But what Lyra does to support the immune system is we've chosen and use protocols and formulas that we know have that effect on helping that immune system. The first one, it's not boring by any stretch, but at this point, it almost seems boring about vitamin D. I'm not going to have to teach you guys about all the amazing things about vitamin D, but vitamin D has been proven in so many studies to be able to help support the immune system. The dose that Lyra is using is 5,000. We also like to combine it with vitamin K2. Vitamin K2, I call it the calcium coach. So when you take vitamin D, you're messing with calcium, but you got to make sure the calcium knows what it's going to do. So the vitamin K2 helps the calcium stay where it's supposed to stay, so the vitamin D can do what it does. But the point is that vitamin D is important. We have a great vitamin D that we use. It's a staple of Lyra and pretty much every integrative doctor and most people in general that care about their immune system and health. The next few of them here, actually all of them, are obviously more in the herbal kind of world, and they're very specific for what they're doing. And most of these are in one formula that Lyra uses. The next four are all in one formula. And what I love about that formula is the synergism of it, meaning that the angiographics is an herbal thing that supports the immune system in one very specific way, where the reishi mushrooms do more of that immune system, more like that CD57 that I was talking about a few minutes ago, where beta glucans work on another part of the immune system. And then astragalus is also a way of just really boosting that white blood cells. So like that synergism really helping kind of hit all those different angles. And hopefully what you can get from this is that what Lyra is trying to do is to really learn what's wrong and to be able to help focus that, how to help repair things and to look at all the inner workings of the immune system. Because most doctors and people don't even understand how complex the immune system is. And then last but not least is cat's claw. It's one of my favorite herbs and one of Lyra's favorite herbs. But basically, it's like a Swiss Army knife. I'm going to say that word in another minute here. But I do agree that cat's claw, not only does it boost the immune system, it has germicidal properties, has antioxidant properties, and I almost look at it like a natural ibuprofen and anti-inflammatory properties. All right, next slide. Okay, so almost in part of our talk tonight, we want to just transition. So what I just talked about is how to boost the immune system, how to make the immune system stronger, how to fight infections and not get sick. But really, what Lynn was talking about with Hashimoto's and checking for Hashimoto's is looking at the autoimmune. So most people know what the word autoimmune is, but basically your immune system starts attacking itself. So in multiple sclerosis, it's an autoimmune condition where your immune system is attacking the nerves. Celiac is the immune system is attacking the gut lining. Hashimoto's the thyroid. So next slide. So this is a very busy slide, but here's how I explain this is that, first of all, whether you believe in God, believe in evolution, I don't think anyone would agree that God or evolution made a system where we just start eating ourselves or our system just starts attacking its thyroid for no apparent reason. There's usually a root cause, which is obviously what Lyra's kind of claim to fame is, or what we're proud of, is trying to find that root cause of that. So how I explain autoimmunity, people, is by explaining the immune system. And really, we're going to focus on these first two. So a normal balance is Th1 and Th2. So the way we explain is that your immune system has two parts to it, Th1, Th2. And Th1 has like 400 things in it, and Th2 has 400 things. But the way I explain it is that Th2 is how you're like allergic to things, and Th1 is how you fight infections. So like the CD57 is like a Th1 thing. So what happens is, and I'm very aware that this is not politically correct, but what autoimmune disease is that a fat kid sits on one side of the seesaw. So meaning that if you see on this top right slide, when you have autoimmune disease, you have an imbalanced immune system. So when your Th1 is down, you can't fight infections like Epstein-Barr, like strep, like gut infections and those things. And when your Th2 is up, you become allergic to lots of things. So you become allergic to things like gluten and dairy. You become allergic to mold in your house. You become allergic to things outside. And then most importantly for this talk, you become allergic to yourself, which is kind of what autoimmunity is. You're almost allergic to your own body parts. So next slide. So when we're looking at the root causes of autoimmunity, just to give a quick overview, the way that Lyra looks at it is going to be that the root causes are toxins, infections, foods, and leaky gut. So just to kind of package this in a better way, to start off the conversation is you're not going to meet a good integrative doctor in the world who's not going to see an autoimmune patient and investigate their gut. Now, I know we've had our whole other talk about gut and gut function and the sophisticated stool testing we do, but basically you're going to, which we've already talked about, we check to see if you have gluten and dairy sensitivities because those are huge causes of autoimmunity. And then we just quote unquote clean up the gut. So you investigate the gut microbiome with the stool testing, you remove the bad bugs, you put the good bugs back in, you make sure the person's digesting their food well, and then you heal the leaky gut. And that is amazing about what it can do for autoimmunity, especially autoimmune conditions like psoriasis. Like you have a psoriasis patient and you work on their gut, most of the time their skin will improve. Next slide. So this slide's a little bit busy, but really to finish off the root cause stuff. So food and leaky gut, and then toxins and infection. So you see number 4 there. So number 4 is identify potential toxic overload and ensure detoxification pathways are optimized. I know that's a busy sentence, but basically Lyra does offer some relatively sophisticated toxicity testing. We're not going to be saying you have exactly this toxin in your body. We're looking to see how your liver is processing things. And then when we see these elevated values, we know that you need to do things to clean up your body and to detoxify your body. And then number 5 is the key things that Lyra does to look for stealth infections is the Epstein-Barr, which we talked about, the strep that we talked about. And then the last 3 there are chronic infections that have been linked to autoimmune disease, which you get through the stool testing. So Candida, H. pylori, and Blastocystis. But then to go to the top of this slide, when when any integrative doctor, and especially Lyra, is looking at how to help the immune system and how to help autoimmunity and how to help, it's basically just make the body as healthy as possible. Like Lynn was saying, all those different foods, all the different sleep habits, those are all going to contribute to building up the one part of your TH pathway, that TH1, TH2, while we're working on balancing it. So really balancing hormones and support deficiencies. And then number 6, just this foundation stuff, eat a healthy diet, sleep well. And, a lot of patients that reach out to Lyra or reach out to integrative doctors, they're usually pretty motivated to get better. And they realize whatever I'm doing with my health is not working now. And when we show that they have autoimmunity, it gives them even more motivation to get their health in order. And when you start balancing all these things, a lot of things will get better. Next slide. So then what about supplements for autoimmunity? We could probably we already talked about supplements to improve your immune system. And these are supplements that are more directed at autoimmunity. So I'm going to use that word Swiss Army knife again, and that's definitely what curcumin is. Most people have heard of curcumin, but more people have heard of turmeric. So turmeric is why Indian food is yellow, and what's good about turmeric is curcumin. Most people, even if you have a bottle of turmeric at home, I bet you if you look at the side of the bottle, it's not turmeric, it's curcumin. It's just the marketing people know that people know the word turmeric and not curcumin. But what curcumin does is so many different things, all the way from immune system regulation to gut protection. It definitely helps the liver, supports the liver, detoxifies the liver. It's been proven to have anti-cancer properties. But really, the main thing that I think curcumin does is it's anti-inflammatory. It's once again like a natural version of ibuprofen that's quote unquote good for you. The second supplement would be selenium. That's very specific for Hashimoto's. We don't have to get into the geeky reasons why it works, but it has been shown to lower Hashimoto's antibodies. And that's why we're using it as something really good for your immune system. Selenium also helps your white blood cells in your immune system, but it also helps the conversion process in how your body makes bad Hashimoto's antibodies. And then the next supplements are 3, the glutamine, aloe, and colostrum. Those are basic, like the standard of care for leaky gut, so supports the healing of leaky gut, which is almost always present in autoimmune issues. Those are the things that we have found that work. And then kind of the secret weapon, we are calling low dose naltrexone. Next slide. So I kind of go to the way I'm going to explain this is go backwards into a story about it, is that so low dose naltrexone actually is pretty much more popular because it was a study done 2 years ago or a year and a half ago that showed that it helped long COVID symptoms. But basically what naltrexone is that how it became invented was back in the late 1980s. There was a doctor up in New York treating HIV patients, and he realized something very weird, that all of his HIV patients that were dying had never done heroin before, and all the patients that were living did heroin. And they were off of heroin because they were taking an opioid receptor blocker called naltrexone, and they were taking it at high dose. So they were taking high dose naltrexone. And this doctor in New York figured this out before the invention of drugs for HIV. So what had happened was he had no other way of helping these patients, and these patients were going to die. And he said, well, look, all the patients that were living were on high doses of naltrexone, so let's just give everyone high doses of naltrexone. And to surprise, a lot of people lived. And then he started researching it and understanding why it works. And as you can see, it's an immune modulator. So I call it a TH1 to TH2 balancer is what I call it. But what happened is when he gave this medication at high dosages to someone who had never done heroin before, they couldn't sleep and they got nauseous. So being a really smart doctor, he just kept lowering the dosage. And it got to a very low dosage of this prescription. And he basically figured out to balance your immune system, because HIV patients don't die of HIV. They die because the immune system gets hijacked by the virus. That's the TH1, TH2 we were talking about. And then the bacteria kill the patient in HIV patients. So he actually had such a kind of aha moment about how much this balances the immune system that this doctor actually thought that, well, if it's balancing my HIV patient's immune system, why don't I give it to autoimmune disease? So he gave it to patients who have MS, patients who have rheumatoid arthritis, and he realized it actually started really balancing their immune system. And he put a website out, which I welcome any of you to go to, called lowdosenaltrexone.org. He put this website out about 20 years ago, and it's still in existence now. But ever since then, there's many studies out about how naltrexone is a natural immune, it's not natural, how it is an immune modulator. There's even an entire website, I think it's called lowdosenaltrexoneresearch.org or ldnresearch.org. It's an entire website devoted to the research behind this. This is not, as I made that error a minute ago, it is not a supplement. It's actually a compounded medication that you have to get from a compounding pharmacy. But it would be weird for us at Lyra to talk about autoimmunity and not talk about this kind of superstar kind of secret weapon we use to balance the immune system. Now, I will also say that I am not against, and Lyra is not against, the regular conventional treatment for autoimmunity. We are well aware that people don't want to do some of the conventional treatments for autoimmunity. We're not against them. It's just that Lyra wants to find the root cause. It wants to, dig down and figure out what's going on, help you become healthier, and balance that immune system the right way. Next slide. And then once again, the takeaways to support the immune response, whether it's weak or whether it's imbalanced. And that's what's awesome about integrative medicine, is that it's all this stuff is so synergistic together, whether its immune system is weak or whether it's imbalanced, a lot of the treatments are the same. So obviously address diet, sleep, movement, stress, good sleep, work on the gut, the toxins, the hormones, the infections, and using targeted supplements. And then this low-dose naltrexone we talked about. Next slide. And that's it.
All right. Thanks, you guys. That was excellent. So, Lynn, there were some really good questions that I saw you answered. Can everybody see those when you answer? I'm just wondering if it's helpful. If there's helpful information, if you want to just run through those real fast.
So let's see. Someone asked about vaccines, and if you have an autoimmune condition, should you be careful about receiving vaccines? And so I answered this in a general way with the caveat that every situation is different. But in regards to Hashimoto's, it's not considered to be one of the ones that you really need to worry about. So if it's Hashimoto's, there's really no safety concerns. But if it's a systemic autoimmune condition like lupus, rheumatoid arthritis, and you're in an active flare, or even Crohn's, ulcerative colitis, any of those major autoimmune issues that are actively present and you're in a flare, that's not a good time to get a vaccine, any vaccine. It should be put off until you're in a remission state. But again, that's a general answer to that question. Someone asked if I recommend taking magnesium along with vitamin D, because they had heard that if you have low vitamin D, you also have low magnesium. Maybe. I don't think necessarily all vitamin D means low magnesium. That being said, most people need magnesium, and we do find it's not something that's routinely tested for, but a lot of people are deficient. It's a very, very common mineral deficiency, and most people do benefit, especially if you have Hashimoto's or another autoimmune condition. And lastly, someone asked about if people taking immune boosting supplements or herbs that they don't really need, like if they're not sick or have an immune system issue, can the immune system be overstimulated or inflamed, or will the body just use what it needs and discard the rest? That was a good question, and I'll let Mark chime in for this. And I said it depends. Some immune system supplements are rather stimulating, and if you don't need them, they're not, I don't think they're going to hurt you. They're not really going to help you. There are certain things like vitamin B vitamins and vitamin C that are very innocuous. You can take them. If you don't need them, your body's going to pee them out. They're going to excrete them. They're not going to hurt you. However, there are certain conditions, like if you have an autoimmune issue, for instance, the herb elderberry is not recommended. There are certain things that can be stimulating in the world of an autoimmune condition. So it was not it was a great question. It's a complicated answer. Mark, do you want to chime in on any of those?
Yeah, no, I'll just answer the last or give my opinion about the last one is that it is a really interesting phenomenon because when I was talking about the Th1, Th2 imbalance, a lot of people misconstrue that if you have an autoimmune condition, you need to stay away from every single herb and every single vitamin that's going to bump up your immune system. That's not really true. There's that Th1, Th2 imbalance, you need some immune support. I will tell you that I think echinacea is too much. I think that there's a few different supplements that I think are just way too stimulatory for the immune system to be worth it, worth the risk benefit ratio. But the things that Lyra offers, the synergistic blend that we're using, none of those are going to there's such low dosages of each of them. We're using them more for the synergistic effect than how much they're boosting the immune system. So I'm not worried about those specific supplements in that. But I just don't think anyone should be taking super high dosages of any of those herbs. It's just not worth it. It's better to be on lower dosages and use synergistic formulas than to just rely on one thing at really high dosages.
Very good. Any other questions from anyone? Well, thank you all for your active engagement and great questions, and hope everyone has a wonderful evening, and look for your email. I'll be sending something out early next week about what our plans are for the workshops in September and October, and some more information as well. So thank you, everybody. Thank you, Lynn and Mark.